Hi everyone, thank you for tuning back into my channel. As I stated to you all in my previous video, I have been diagnosed with Pigmented Pupura Dermatosis, better known as PPD. This is where you end up having bumps, whelps, lesions, whatever you want to call those three, that appear for me on my hairline, my arms, my thighs, my legs, and my feet. They don't appear on my torso or my back. Go figure. I occasionally have 2 flare-ups, every year. I've seen that they come around in the summertime, preferably June, and then I notice them again in November. So summer and then fall, right? So when these flare-ups occur, I make sure that I journal, what I'm experiencing, the severity of it, how I'm feeling. I also put it in my phone, in my calendar, because let's just say if I have to go to the doctor's, I can just open up my phone and, pinpoint everything right there before I get, my prescription or whatnot. But it's good to journal these things because, we're getting older, okay? I went to an allergist when I was early stages of this. I went to an allergist, and because I assumed that maybe I was allergic to something, right? Could have been something that I ate, could have been my detergent, just anything, right? I'm trying to do my research here. I'm trying to do my homework, trying to get to the bottom of it, right? So when I went to the allergist, what they did was they just shot me up with things to see what I would be allergic to. And lo and behold, I was allergic to dust mite, cat hairs, that sort of thing. But they could not determine, exactly what was going on with me. They just could tell me, okay, I'm allergic to these things. Come on in the office, every 2 weeks and get an allergy shot. That didn't sit well with me. I'm not the kind of person that just, oh, sure, I welcome every medication in my system and just go. No, I'm not that kind of person. So next I went to a dermatologist. A dermatologist looked at me and said, oh, this is hives, urticaria. Go to your nearest pharmacy, get yourself some Benadryl and some hydrocortisone cream if you're dealing with any itchiness, any bumps, and come back and see me within 4 to 6 weeks. Needless to say, it was beyond hives. It was not hives. That was not it at all. And there was no way that I was going to be walking around, looking like Bumpy Johnson or, Bumpy whatever, or look like somebody beat me up with a baseball bat, and I got to work. Okay. So come on now. I can't walk around looking like that. And so I went to another dermatologist, okay? So it's like a 3-strike rule with me. I already went through 2 people. This last person got to work, So I went to another dermatologist, and she sat me down. She was really digging deep, She didn't come across as a person who was just interested in, prescribing something and here, off you go. She really wanted me to think, to dig deep. Meaning that she was asking, about family members, my immediate family. Was there anyone that was dealing with skin issues? My mother, my father, sister, brother, that sort of thing. And so I was able to remember seeing my mom go through it because she has psoriasis. And during that time, the medication that we have today, they didn't have then. So the way in which she was dealing with her flare-ups was by just using hydrocortisone cream. But I saw the toll it took on her, both physically as well as mentally. And I just would pray, that I didn't end up having to deal with that because I saw what she was going through and I wanted no parts of that. I did recall during, I would say, teenage years, up to maybe early 20s of dealing with eczema, okay? And for me, that was, rashes that appeared whenever I wore costume jewelry, fake jewelry, right? And so once I stopped wearing it, eczema went away. So that was a no-brainer to me. That's why to this day I don't wear, jewelry that much, because I'm just always, on a defense about things. Okay. Basically, I have sensitive skin. That's just what I've come to realize. Okay. So when I experienced that and then dealt with it that way, I didn't have, any more flare-ups regarding eczema. So fast forwarding, again, I'm still sitting down having this conversation with this dermatologist. I explained to her that when I was pregnant, I noticed that I had a rash on my foot, on both of my feet to be exact. And they looked like reddish brown, reddish brown, cayenne looking pepper flakes, if that makes sense. Okay. That's what was appearing on my skin, on my feet. And I really just contributed that to, being pregnant, a lone pregnancy. This is some of the things you go through when you're pregnant. And so what I just would do when these things were flaring up, I would just put hydrocortisone cream on them and just, leave it at that. And they would eventually fade away, which, yeah, that's what they did. But didn't know that that was leading up to me having PPD. So, like I said, the dermatologist, she went ahead and did a skin biopsy, and that's where they take a little piece of your skin, in an area that's not noticeable. So for me, it was my inner thigh. And then that's when they took it to a lab, ran a series of tests, and then that's how it was confirmed that I had pigmented pupura dermatosis. So that's what I have. I have it written down. I'm okay. Okay. I know what it actually is. So now, medication. Keep in mind that there's no cure for pigmented pupura dermatosis. There's no cure. But are there medications to help you, combat this along the way whenever you should have, flare-ups? The answer to that is yes. I've done my research. Now, by no means am I, a doctor, okay? I'm not offering any medical advice whatsoever. I'm just sharing to you all what I, have done as far as my research. Just sharing, okay? So when it's all said and done, you're going to be the one to have to make that decision for you. So the first medication, or I should say ointment or cream, was a corticosteroid by the name of clobetasol. And with this, and I love to be exact because when it's all said and done, I want to share the actual pros and cons, okay? With this cream or ointment, it helps with inflammation, skin that happens to, be itchy. The cons, it should only be used for 2 weeks at a time to prevent thinning of the skin. So again, 2 weeks at a time to prevent thinning of the skin. So my thing is, too much of this, you could be sitting there scratching somewhere and piece of skin start falling off. I don't know. I'm just saying. But I personally don't like the feel of ointment or creams all on my skin. It's just I don't know. I just don't like that. I don't like that feeling. So I only used it for about maybe 2 weeks. And that's when I said, I got to look into something else. Okay. So again, this is just this one. Next, we have vitamin C tablets. So I'm sure everyone is taking their vitamins on a daily basis, right? What I was doing is amping up my vitamin C by taking additional vitamin C tablets, 500 milligrams, okay, 2 tablets. And this is to prevent, or protect rather, your body from diseases, okay? Vitamin C is your best friend. But taking too much of vitamin C could result in diarrhea, nauseating feelings, stomach cramps. So just be mindful, of the vitamin C tablet intake. I always suggest going back old school and going to your local grocery store and picking up a couple bags of, oranges and peeling them oranges, They work, if not better, okay? That's number 2 right there. Now, 3 is Ruticide or Rutin, okay? 50 milligram, tablets. This is supposed to ease the inflammation. Some side effects is blurred vision, stomach upset, headaches, and flushed skin. So keep in mind with that. Now, did I use Ruticide? I sure did. I, was talking to a dermatologist, asking her thoughts on it. Although she knew some things about it, she wasn't sure if that would help me on my journey with dealing with PPD, but she prescribed it to me, and I took it. I took it for about 3.5 weeks. The reason why I stopped is because it was upsetting my stomach, and I couldn't go through that. Okay. So next, but hey, it may work for you, for narrowband UVB therapy. Okay. Now this is where they lay you under, lay your body under, this light, this UVB light. Now with this, you want to only consider this if you're dealing with difficult or persistent cases of pigmented purpuric eruption. Okay, so the downside I felt like for me was if I was calling, to schedule an appointment, I'm not going to be seen that day. I may not be seen the next day. I may not be seen until, 3-4 days down the line. Who knows? But will I still have, this eruption during that time? I may not. So it's kind of like, you gotta weigh this yourself on this one. But again, that's number 4 on my list, that maybe you may want to consider. Okay. But what has worked for me since 2019 was methylprednisolone. I call it the Met Pack. Okay. It's my best friend at this point. And this methylprednisolone pack has a series of tablets that you have to take. You take as directed with plenty of fluids. I prefer water, okay? You have to take a pill before you have breakfast and a pill after you have breakfast, okay? But you want to, again, follow the instructions to the T. Don't go out here doing your own thing. Follow the instructions to a T. Now, the side effects or cons of, taking methylprednisolone is that it decreases your immune system. Unfortunately, it decreases your immune system drastically. So anteing up that vitamin C, it sounds pretty good at this point, right? Yes. You want to take note of that. Also, you could experience nausea, vomiting, heartburn, headaches, dizziness, as well as trouble with sleeping. That's a whole nother video I want to share because I too am victim of bouts of insomnia from time to time. But again, this is what's been working for me since 2019, taking methylprednisolone. Maybe, just maybe, this may work for you, but you may want to get with your doctor. And again, you both sit down and have that deep discussion. But again, this is what's working for me. Okay. My next video, I'm going to discuss with you all lifestyle changes, because when things start happening, I think it's a sign of, that you need to look within, and everything is not always taken care of with a pill. Okay. If you kind of go within yourself and see, what are you eating? What are you drinking? What are you doing? Maybe those things right there, you really, really need to look at, reevaluate, and change. You just never know, but it starts with you. So I would give it a try. For me, I like to incorporate more vegetables, more green juices for those that may like, green juices, that sort of thing. Your stress levels, that's also, important as well, because stress is a serious factor in and when you happen to get flare-ups, okay? Excessive exercise, for those people that love to hit the gym and all that good stuff, you may want to kind of cut back on that just a little bit. Again, these are lifestyle changes, I feel, okay? And then lastly, dealing with a form of depression as a result. That's me. That's what I currently feel or go through when I see, a flare up. Again, like I said before, I'm dealing with a flare up right now. And I'm not going to lie, there have been moments where I felt like, wait a minute, like, why is this happening? But then I say to myself, you know what? It's okay to stay in the moment, but you have to decide how long you want to be in that moment. So keep that in mind as well, if this is what you're experiencing. So I'm going to share my tidbits all in the next video. But before I leave, if you like the content I'm sharing so far, please do me a favor and hit the like button. Please subscribe. Even leave me a comment, because I check my comments. If you have some ideas or other medications that I haven't disclosed in this video right now, please share it with me. Each one teach one, okay? And I look forward to talking to you more in the next video. Please take care.